From data to prevention, AI as your health partner. My team sees the interpretation of this theme as a really big and bold way to solve a prevalent problem that affects the Nigerian populace with regard to health workers and patients as well. We have a situation where a lot of health workers are moving in large numbers, in droves, out of the country because of the poor conditions they are put into. Here, we can see a lady that shows her 24-hour schedule, and then she is the only doctor in that government hospital. Here is a young guy just doing his NYC, as at the time he died. He slumped from a 72-hour shift, a 72-hour long shift. Here we have on Punch newspaper another doctor who died after a 72-hour shift, and talking about an actress's only son who died as a result of poor health conditions in the country. And so we came up with Aidcare Copilot, an AI cognitive shield for Nigerian doctors. We know it's the work of the government to improve many of the situations the doctors are facing, but how can we come in? We can come in to solve some of the problems they have to deal with every day, some of the redundant tasks that can be automated, and that's where Aidcare Copilot comes in. It's an AI cognitive shield for Nigerian doctors and an intelligent assistant that sits beside physicians during their shifts, silently absorbing the burden of documentation, protecting the quality of handovers, and surfacing early warning signals when a doctor is dangerously overloaded. With Aidcare, we have the triage, we have the scribe, we have the burnout part where the admins can see how doctors are faring. For the triage part, it is built on Nigerian national standing orders from the Nigerian Health Ministry. And with this, the doctors don't necessarily have to be the ones to attend to all patients. Other medical personnel can supervise this system with minimal effort. It's also available in all major local languages. We have Hausa, we have Yoruba, we have Igbo, we have Pidgin, Niger Pidgin. And you will see a demo of how it works at the end of this video. Here it asks, hello, how are you feeling? And then the conversation goes on. You just need minimal supervision with this. For the Yoruba one, for instance, it will ask in the Yoruba tone with an interpretation there for the health worker that may be supervising who may not understand the language. And if you listen to it, the tonality is really good, really clear. We also have for Igbo and Hausa as well. I would play for Hausa.
Sannu, ina nando taimaka maka da lafiyarka. Zaka iya rubuta kwa amfani da microphone. Ka fada mini. Yaya kakeji?
And towards the end of the video, you will see conversations happening with full triage conversations happening. And here we have Scribe that allows the doctor to record doctor-patient conversations. We'll also see a demonstration of this toward the end of the video that allows the doctor to record doctor-patient conversations. It also is local language supportive, and will then generate the voice to SOAP, auto scribe, and form the subjective objective assessment and plan feedback and inference from that. And then the doctor can review it. That's where because many people don't really trust AI, so the doctor can review it and then sign the notes. You'll see more on this toward the end of the video as well. And then here with patients, you can view all the patients in a particular hospital. All health workers have access to the patients in that hospital. It takes a while to load. And the system for Aidcare Copilot is such that the organizational hospitals, the NGOs, the government health bodies are the ones to subscribe to the system, and then they have their hospitals under the system, and those hospitals have their respective health workers under the system. And here is details on a particular patient, Shegun Ajayi. He has not had any consultation history yet. I will go to someone that has had a conversation history, and we will see more about this patient. Here is Emeka Okafor. His last recorded blood pressure, his heart rate, temperature, and all of that. And he's recently recorded consultation history. Every consultation that has happened is stored and is also a reference to future conversations. So it helps the system understand better how to relate with the patient. And here you can see more about it. Here you can print the record. And if a doctor is to go on leave, for instance, or to go on off shift, the doctor can hand over to other doctors and generate a report here. You would see more of these features at the end of the video. Good morning. What brings you in today?
I have a sore throat and a running nose for 2 days.
I'm assessing upper respiratory tract infection. I'll prescribe paracetamol and advise the rest. Drink plenty fluids. Man, how can the speed of this thing increase? That would be a lot of engineering work. Okay. Is I recording audio? Waiting for what to load? Yeah, I was waiting for something else. But for the final result, this thing should stay. I'll come back to that one. This is very important. Why is there a button here and it's not leading to anything? To record it. Like a second person. When I want to record it's going to be a conversation between two people. That demo is going to be long. They didn't give time limit for the demo video. Okay. It's not connected to your AirPod, right?
Sannu, ina nan don taimaka maka da lafiyarka. Za ka iya rubuta amfani da microphone. Ka faɗa mini, yaya kake ji? Zan tambaya, kana da tarihi ciwon makoshi ko wani nau'in matsalar numfashi? Na gode da bayani. Kaga wani canji a cikin ganin gujewar kai. Ina baka shawara ka je wurin asibiti nan da nan don karin duba lafiya.
Ẹ káàárọ̀, mo wà níbi láti ràn lọ́wọ́ pẹ̀lú àwọn àmì àìsàn rẹ̀. Ó lè dáàbò tàbí lo microphone. Jọ̀wọ́ sọ fún mi bí ó ṣe ní. Ṣé o ti ní ìrírí ìtọ́ ẹ̀jẹ̀ rí tàbí ìrọ́lẹ̀? Ǹjẹ́ o ti ní ìrírí ibà èrò ọkàn tàbí ìrora nínú orí rí pẹ̀lú àwọn àmì àìsàn rẹ̀?
No, Ano mebe a iji nyere gị aka na ihe ọ bụ na-eme gị. Ị nwere ike idere ma ọ bụ iji microphone. Biko gwa m, gịdị etu a. Ọ dị ma biko gwa m, ị nwere ike ịmata ma ọ bụrụ na ị na-agbakasị afọ ụfụ dị elu ma ọ bụ na ọ na-aba ụba mgbe ị na-eme ihe ụfọdụ dịka ịga ije ma ọ bụ izu ike. Ọ nwere ike ịgwa ma ọ bụrụ na ị na-enweghị ụra nke ọma n'abalị ma ọ bụ na ị na-anụ ntị mkpọtụ ma ọ bụ ụda dị iche iche n'obi gị.
How you dey? I dey here to help you check your body. You fit type or use microphone. Tell me, wetin dey do you? You dey vomit or you dey feel like say you go vomit? You dey get any stool wey be like water or pass normal?